It's my life. Lazy, 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 lazy. It's my life. I got dirty, 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 dirty. It's my life.
Hi guys, it's me again. Welcome back to my channel. So yesterday I did a video for Siemens Akuson, and now I have here our ultrasound machine here in room 3. As you can see, the machine is still closed because every night we need to close all the machines. Night shift sonographer used to use this machine, the room 3 machine. So this is my room, this is our room. Yeah. This is where we are keeping our towels and blankets. And those are our stocks here. We have the gel, the gloves, and we have the separate thermal heater here. Okay, so this is a Toshiba machine. Okay, Toshiba i700. Okay, so now I will show you how to use this machine. Let me just turn it on. This is the power button. Let me wear my gloves. Okay. So now this machine is ready to use. Here we have like 5 probes. We have the transvaginal probe. We have the linear probe here. And the V2 probe. This is used for OB-GYN, but we are not used to use this. We used to use the curvilinear. I'm sorry for this, it was broken. And here is a curvilinear probe, and one more linear probe. Here in the knobs, we have almost same. I think all machines are same. It's just like the position of the buttons are in different place. So we have here the power Doppler, the color Doppler. We have the zoom here. I mean the gain. We have the gain here, the 2D. This is to store image, to freeze and unfreeze. This is for the dual and for the single screen. And if you want to print on the thermal paper, but we don't use thermal paper here. And if you want to make a video, you can save it by pressing this. You can measure also using this caliper button. This is for the annotation. This is also for the annotation also. It's like body marker. Yes, this is the body marker. And I don't know what is this button. If you know this button, kindly comment down below. These 3. And we have here what do you call this, widescreen. I don't know if am I correct. Widescreen and Doppler reverse. And also we have this trackball here. If you want to do an immediate scan, you can just select X. Okay, then this menu will appear. This is the exam button. This is the settings. So we don't want to configure anything from this machine, so I will just gonna show you. So here is the preset of the probe. Okay, and here if you will gonna search for a certain patient, but I will not press this because names of the patients will appear and it's not allowed for patient confidentiality. And what else? We have here the time gain compensation. If, as you can see, this is a touch screen and the keyboard. Okay, so you have also here the selection of the probe. We have the the TV probe, the transvaginal probe, the L4, the L5 linear, and the curvilinear. It's all the same. It's all the same in all machines. You can see here in the TV probe, you can see endovaginal. And while using the linear, you can see the carotid and the small body parts here. Then for the curvilinear, you can see here the general ultrasound, which is the abdomen, OB, gynae, like that. Patient's information. Again, patient browser, worksheet. We are using this for pregnancy. So if you will click the worksheet, all the measurements from the OB gynae will be there. So you can see here the name will appear, the examination, the date and time, and we'll try to open. So this is the, okay, so we don't have patient, so I will show you. So if we will be having a patient, what we are going to do is click the exam button, this exam button, and this menu, and this menu will come out. So we have here the schedule, means all patients that are scheduled and arrive from the front desk will be here. Okay, then you need to refresh the work list. Then same as the other machine, you need to select the correct name. You need to ask the patient about regarding their name, date of birth, and double check the MRN also if you have the right patient. You can also do manual typing. Again, you can type here the MRN of the patient, the last name. Let's just remove. Okay, so the MRN of the patient, last name of the patient, first name. What else? Here, you need to put the date of birth of the patient and select the examination description. So, like for example, here you can see abdomen, carotid, Doppler, OB-GYN, coronary, MSK, prostate. Okay. So, for example, again, it's OB. Again, in OB-GYN, you need to put the LNP of the patient. We'll just put 2021, 04, 01. So we have here the gestational age, which is 21 weeks and 4 days, and the estimated date of delivery will be 2022-1/6. So that is very important if you will scan OB patients, so that the radiologist can include on the report the estimated date of delivery of the patient. Okay. So let's just proceed with the abdomen ultrasound. Okay. Anyway, okay, so assume that we already selected the right patient and we already fulfilled all the details needed. We just need to press start. What we need to do is just close this and we can start the scanning.